Are you a physiotherapist who tries to understand the reasoning behind every exercise and treatment technique that you give? Or are you someone who follows protocols without knowing the rationale behind it? Hi everyone, in today's video, I'll be discussing about this one essential skill, which is critical thinking, and why it is extremely important if you want to develop great clinical skills. So, what is critical thinking? It is questioning everything that you see and do, from assessment to making a diagnosis to the treatment that you give. It's being curious about everything. Instead of doing something just because you're told to do, you try to find out the why behind it. There's a famous quote by Aristotle which says, "The more you know, the more you realize how much you don't know," which reflects that diving deeper into knowledge often reveals the vastness of what's left to learn. I'll try to explain the importance of critical thinking when it comes to treating patients with the help of an example. Sarah and Jim are two physiotherapists with different approaches to core training. Sarah focuses on fundamental exercises with gradual progression, whereas Jim takes the evidence based approach. So basically, Sarah's approach is to give exercises that maintain the core, whereas Jim takes the initiative to explore the anatomy and function of core muscles. He learns that there are two types of muscles: local or deep, and global or superficial. He reads various research articles and finds out that core weakness is often due to overactivity in the superficial muscles and inhibition of deep muscles, and therefore, effective core training should prioritize activating deep muscles first. This involves exercises like abdominal hollowing and multifidus activation. Once these deep muscles are properly engaged, he then incorporates exercises that focus on the coordination of superficial and deep muscles, such as posterior pelvic tilt and abdominal bracing. Now let's compare the outcome of both the approaches. While effective, Sarah's approach lacks an understanding of underlying mechanisms of core muscles. So the patient may see an initial improvement, but the progress is ultimately going to plateau. Jim will definitely see a lasting improvement in the patient's recovery as he addresses the root cause of the core weakness. This comparison illustrates that understanding the rationale behind every treatment choice is extremely crucial for effective patient outcome. Think about your approach. Are you diving deeper into understanding or relying on superficial knowledge? If it's the latter one, you might be a good doctor, but you'll never be able to become a great one. True mastery comes from going beyond the basics and challenging yourself to do something that's harder, to do something that's beyond your comfort zone, because that is when you grow and get better.